Come in.
Hey, how you doing?
Good.
My name is Alain. I'm going to be the nurse in charge of you today, so we're going to do a head-to-toe assessment, okay? So before I do that, I'm going to go ahead and wash my hands, and I'm going to provide for your privacy, so I'll be right back, okay? Okay, so I'm going to demonstrate how to wash my hands. So first thing I'm going to do is grab 4 pieces of paper. Four. Okay, I'm going to open the water, comfortable temperature. Lukewarm water. My soap.
Good.
All right, I'm back. Well, I'm back. Can you tell me your name?
My name is Bo Zahn.
All right. Do you know what's your date of birth?
August 5th, 1991.
Okay, let me check in your thing here. Okay, the information seems fine. Do you know where you are right now?
I'm at Rasmussen College.
Rasmussen College, okay. And do you know what date it is?
It is February 14th.
You sure?
Yes.
January
January 14th.
Okay, don't worry about it. Yeah, and don't be nervous. This is a regular test, nothing to worry about. So patients are oriented to time start, pretty much. So person, time, and place. So what I'm gonna do is I'm gonna start taking an assessment of your head and the upper part of your body. So I'm looking for symmetrical features on your face. Everything looks fine. Everything is central in there. Can you raise your eyebrows for me? Okay, that's fine. Can you puff your cheeks? Can you smile for me? Okay. I'm gonna do a sensitivity test on your face. So if just to test your cranium, some of your cranial nerves in there. So if you can close your eyes for me and tell me what I'm touching.
Forehead.
Okay.
Left cheek. Right cheek, chin.
Okay, you're good in there. Pen light. Give me 1 second, let me go and get my pen light, okay? Okay, so I'm gonna go ahead and check for, just look at me, I'm gonna check for the reaction of your pupils to light, okay? So, okay, fine there. Okay. Do you mind looking at the distance over there at the wall? Okay, can you look at my finger right now? Okay, you got good accommodation in there. Let me take a look at your nose. Okay, no discharge. Can you put you cover one of your nostrils? Okay, the other one. Okay, that's good. Let me take a look at your mouth. So you open for me, your throat looks fine. Can you lift your tongue? Okay. It goes on the mouth. There's some good coloration and all that. I don't see any problem. Good teeth are in good care in there. I don't see any lesions in there. Can you turn your head that way? Okay, this way. Can you look up, down? Okay, I'm gonna take a look at your ears now. All right. So no discharge or any obstruction of the canal. Same with this one, no discharge or obstruction of the canal. I'm gonna do a whispering hearing test, okay? So I'm gonna cover one of your ears and just tell me what I'm whispering to you, okay?
Cat.
Okay.
Building.
Oh, okay. Did a good job in there. Okay, so what I'm gonna do now is I'm gonna feel your carotid pulse. Okay, so I'm gonna do one at a time. Okay, sounds good in there. Okay, pretty good in there. Let me go ahead and listen to your well, on the pulse now. Let me go ahead and feel your brachial pulse. Okay, the pulse is strong and it's even on both ends. I'm gonna do your radial pulse. Okay, you're good. And what I was doing now, I was observing your respiration. Your depth is fine. Your rhythm is fine. So and I don't see you using any extra muscles to breathe. So you're not under any distress breathing right now, right? Okay. I'm gonna go ahead and listen to your heart. All right. So let me go. You mind if I don't know, lift your shirt here? So what I'm gonna do is I'm gonna listen to find your second intercostal. I'm gonna listen to the aortic. Oh, okay. I'm gonna listen to the pulmonic on the other side. Okay. I'm gonna go down one space to the Erb's point. Okay. Tricuspid, the fourth intercostal. Okay, and then I'm going to listen the clavicular line right here to the apex. Okay, you got a strong pulse in there. I'm going to go ahead and now listen to your lungs. All right, so I'm going to use 6 points in the back, in the front, 6 points in the back, and 2 points on each side. All right. So let me go ahead and can you breathe through your mouth while I do that? Go ahead. Okay. Go ahead. Okay. Go ahead. Go ahead. Okay. Can you lift this arm for me? Right here. Go ahead. Go again. All right. Thank you. Let me use the side now. Go ahead. Go ahead. Okay, I'm gonna listen to the back now. Can you cross your arms for me, if you don't mind? Thank you. All right, go ahead. Go ahead. One more time. One more time. One more time. Okay, while I'm here on your back, let me go ahead and check for your spine alignment. Okay, everything looks fine in there. This part, I'm going to check for some range of motion. Can you lift your arms, put them on top of your head, behind your back? All right, go back to this position. Now let me pull down, push down, and let me pull up. Okay, put your hands like that. All right, let me push you. Let me pull you. All right, so can you do this? All right, let me go ahead and check your secondary refill. All right, good capillary refill. Let me check for temperature. All right, temperature is normal. No edema of the upper extremities. All right, so I'm gonna have you lay down for me if you don't mind. Okay, so what I'm gonna do now is I'm gonna listen to your bowel sounds. Okay, can you lift your shirt a little bit for me? Let me take a look at your abdomen. Okay, it has a flat shape, so I'm gonna start on the right lower quadrant. Okay, it's usually the most active one. Okay. All right. Okay, that sounds good. I'm gonna palpate your stomach. Okay, are you in any pain, or if you feel any pain, just let me know. All right. Don't feel any masses. Everything seems fine here. When was the last time you have a bowel movement?
Last night.
Last night. How about urination?
Everything
Everything is fine in there.
Yeah.
So no issues that you want to report this time.
No issues.
Okay, you can put your shirt in there. Let me go ahead and check your legs. I'm gonna pull up your pants right here, real quick. I'm gonna check for symmetry of your muscles. Everything looks fine. I'll check for temperature. Temperature looks normal. I'm gonna check capillary fill of your toes. All right, everything looks fine in there. I'm gonna take your dorsalis pedis pulse. Okay, you got an even and strong pulse in here, and then your posterior tibial. Okay, can you lift you bend your knees? Okay, you can bring it back to the same position. Can you sit again for me? All right, I'm gonna go ahead and check to the your thorax. Forget that forward. So, you're fine. 1 to 2 to 1, and let me go ahead and can you try to lift your legs? Okay. Let me go ahead and put pressure on it, and let me pull here. Okay. Go ahead and kick that one, kick your other one. So your range of motion is good in there. All right, do you mind standing up for me? Can you walk to the wall? All right, turn around, come back. All right, gait is okay. Balance, posture is relaxed, and you don't seem to have any problem in there. Can you put your feet together? Okay, I'm gonna do a balance test. Okay, so same fine with your eyes open. Can you close your eyes for me? Okay, your balance is good. You can take a sit again, and that's it pretty much. I'm gonna go ahead now and watch my hands again and document the findings. Okay, so we'll see you back in like about an hour. All right. If you have any questions, let me know.
Thank you.